Two young men enter Mind Institute lobby. Title reads, Chris, Young Man with Autism.
I'm Chris Rivera. I am an artist. I'm 21 years old. I have autism. I draw and play the piano. I was diagnosed with autism when I was 18 months old.
Title reads, Catherine Owens, Path Program Manager, UC Davis Mind Institute.
My name is Catherine. I have a 9-year-old son who has diagnosis of autism and ADHD.
Woman in wheelchair on sidewalk.
My name is Lisa Cooley. I'm 54 years old. I have spastic cerebral palsy.
Title reads, Max, Young Man with Autism.
I'm Max Rivera Hernandez, and my diagnosis would be autism. I received it around the age of 4 years old.
Mother and young man at foosball table, then walk away.
Hit the ball. There we go. So Kaylin is a 26-year-old, 6 feet tall boy with autism.
Title reads, Tanisha, mother of adult son with autism.
He's able to get his needs met by limited communication, but for the most part, he is nonverbal.
Boy playing on play structure.
Sammy is joyful, he's full of energy, and he has a wonderful sense of humor. He's 9 years old, and he's in 4th grade.
Title reads, Danielle, mother of son with Fragile X and autism.
He was diagnosed with Fragile X at about 9 months of age, and then later diagnosed with autism.
Child life specialist explains check-in to mom and 2 boys.
So first, mom's gonna check in here at the desk. Then we're gonna walk over to our room that we have over there.
It's very hard to be a parent in a stressful medical situation. You want to constantly advocate for the things that you need for your kids, but it's really hard sometimes to find the right people to communicate to and feel like you're being listened to.
There's times that I would tell Kaylin, okay, you have a doctor's appointment today. It's a struggle.
For Sammy and for a lot of people with the neurodevelopmental disabilities, there's this anticipatory anxiety that happens.
It's a huge preparation to get him dressed, get him focused, tell him the steps that we're going to take before we even get there.
Tanisha and Kaylin walking with arms around each other.
They don't think that everyone realizes the level of anxiety he has that can honestly look like bad behavior.
Sammy holds toys in exam room.
I think underneath it for a lot of kids and adults is this nervousness.
Title reads, Lisa, lives with spastic cerebral palsy.
When I have to visit the doctor, I don't know what exam rooms I will visit the doctor in, so sometimes it's difficult to get into the most accessible room and get on and off of the table.
Medical assistant leads Max and Chris into exam room.
What makes medical appointments harder is that the providers aren't paying attention or aren't giving a good attitude or aren't exactly focusing or paying attention to what's possibly harming your symptoms or not.
Tanisha reassuring Kaylin.
Sick of it.
Yeah, wait till you get home. 5 more minutes, okay?
For Kaylin, coping is hard. He doesn't understand it. His body is feeling something, and the way that he releases that at times by maybe jumping or flapping his arms or vocalizing.
Parents know so much about what works and what doesn't, rather than trying a one-size-fits-all, really asking them what tools work to calm them down and get them through this, I think could be really helpful.
I just think there's a misconception that it's a lot harder to work with neurodiverse kids and adults than it really is, and that it just takes a little bit of patience, thoughtfulness, and really being gentle in what you do and what you ask to make it successful.
I like when the doctor talks to me. Most of the time, they talk to my mom as I am not there, but my mom is always redirecting and making sure they talk to me.
For Sammy, what he really benefits from is people that take the time to get to know him and to give him the space that he needs to process things.
I want medical providers and other professionals that work with them to know that cerebral palsy or other neurodevelopmental disorders are not the same, that there are variations between neurodevelopmental disorders, just like there are variations in people.
I would like the doctors to know that I need simple information that makes sense to me when I am sick.
Honestly, it's better to know their names, just to treat them like individuals.
It's hard as a parent to feel like your child can't or won't do what, the doctors want them to. But when you feel your child's accepted for who they are and there's some flexibility, it really does help the whole family.
Tanisha counting and smiling with Kaylin in Mind Lobby before getting up to leave.
So one negative experience could make the challenge
So hard coming back.
one positive experience could make all the difference in the world. The struggle is not so hard when the experience is positive.
On-screen graphic with UC Davis Health logo that reads, PATH, Promoting Accessibility to Healthcare. For more information on the PATH program, please contact hs-path at ucdavis.edu. Second on-screen graphic with UC Davis Health Mind Institute and UC Davis Health Department of Surgery logos. Final on-screen graphic reads, Funding generously provided by Children's Miracle Network Hospitals.